Yes, thank you, Mac, and thanks, Frank, for inviting me again to the meeting this year. These are my disclosures. So there have been recently 4 worldwide trials looking at the metformin question for small abdominal aortic aneurysm disease. There's an article in today's VEITHsymposium newsletter that goes into some detail. Just briefly, the Swedish trial is an open-label trial. Everybody gets metformin compared to historical controls. It's now enrolling in Denmark and the Netherlands. Anders van Heijnen is here at the meeting this week, and he can answer questions specifically about that. Our trial LIMIT is a prospective randomized placebo-controlled phase 2 level 1 trial that is making progress here in the United States. And then there's the MAT trial, which is in Australia, which has an endpoint, and the UK now, has an endpoint of death by rupture, aortic adverse event, or surgical repair. And that trial is also enrolling now both in Australia and the UK. Just to look at progress, a trial that was previously being conducted in Austria completed, was underpowered, and didn't find any difference. Our trial, the Swedish trial now has enrolled 350 patients out of 500 total, again, open label. Our trial, as of today, is almost 200 patients enrolled with a target of 314. We're hoping to complete enrollment by June of 2026. And the Australian trial, because it's so large, expanded to the UK, and now they're actually looking at possibly enrolling in the United States as well. No data on outcome for any of those. More recently, it's been suggested that potentially all hypoglycemic agents have some efficacy in preventing aneurysm progression, both clinically and in animal models. Both Jardiance, SGLT2 inhibitor, and Ozempic and Wegovy apparently have some anti-aneurysmal effect. Interesting that this entire class of hypoglycemic agents appears to have some effect, although none of that has been validated clinically. The Nectaro trial has started. Mac tells me they're at 25% enrollment already. This is endovascular interluminal intra-aortic injection of a collagen cross-linking agent, PGG, which again kind of follows a similar idea of a diabetes-related inhibitory mechanism. What's fascinating about this is the expense of this trial. Their most recent Series D funding raised $96 million to help them try to complete this trial, in addition to what funding they'd previously generated. So it remains to be seen how that turns out. After a GWAS that was conducted through the Million Veterans Project and through the University of Pennsylvania, Scott Damrauer identified PCSK9 as a allele which expression is related to aneurysm risk and progression. And so they've recently launched a surgical trial where patients are injected with evolocumab, injectable PCSK9 inhibitory agent, and then are undergoing open aneurysm repair to see if there's a difference between those who were injected with it and those who weren't in terms of inflammation, disease progression. This kind of doubles down on this idea that lipids may be related to aneurysm risk, even though statin data in the past has been inconclusive. The theory here is perhaps a more effective anti-lipid cholesterol agent may have some efficacy in preventing aneurysm progression. No clinical trial is underway as of yet. Microbiome targeting, turns out that trimethylamine N-oxide, which is metabolite of dietary choline, which comes with meat, dairy products, et cetera, is known to be enhance cardiovascular disease endpoints. And by inhibiting formation of TMAO, either by oral antibiotics or enzymatic inhibitors or genetic knockouts in various animal models, seems to significantly slow down aneurysm progression, which may provide a link between diet and aneurysm risk. And finally, aspirin. Retrospective study recently in the Cleveland Clinic looked at many years of follow-up for patients in their database who had small aortic aneurysm disease, simply looking at aneurysm progression in those who were taking aspirin versus not. With average about 5-year follow-up, those patients taking aneurysm had a 25% slower rate of aneurysm enlargement, with all the limitations inherent in a retrospective trial. So in summary, there's an evolving understanding of abdominal aortic aneurysm pathophysiology as evidenced by these trial targets. These are now targeting clinical clues, things we already know about aneurysms. Aneurysm trials remain challenging, and we don't have time to go into all details related to that, but it seems likely that there will be answers to this question this decade. And I want to remind everybody that we are still enrolling nationwide in the LIMIT trial. If your patients had a CT scan in the last 90 days, we can manage them remotely for non-diabetic patients, offering them placebo or metformin. Thank you very much for your attention.